Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shepherd, ministre de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Merci.
Thank you, Bruce.
Bon après-midi à toutes et à tous.
Welcome to all.
Depuis le début de la pandémie de COVID-19,
Since our journey through the COVID-19 pandemic, we have learned many lessons in patience, in vigilance, and determination. But in particular, we have learned this. The only thing that is predictable about this pandemic is its unpredictability. This requires that we all be flexible and prepared to respond quickly to new circumstances as they arise.
the more transmissible variants of the COVID-19 virus become more prevalent. We have the UK variant here right now. The Brazil variant has affected Ontario and is now affecting British Columbia. When they happen, we will respond surely and swiftly, as we have done in Zone 4 during the past week. We are rolling out the largest vaccine campaign in our nation's history with our new COVID vaccines. As we learn about these vaccines, we will adjust our strategies to ensure the safety of New Brunswickers. And based on advice from Canada's National Committee on Immunization, NACI, we have adjusted our use of AstraZeneca vaccine for people under the age of 55. So we will be continuing to use AstraZeneca for people 55 and above. Our response to the COVID-19 virus will continue to be nimble. And when circumstances change, and they change constantly, we will adjust our strategies to meet these new challenges. And I'm asking all of you to do the same. The changes in rules and guidance can be difficult. I know the stress it creates. But we are responding to an unpredictable force that will go in directions we can't foretell. Lorsque les circonstances changeront,
When circumstances change, and they change constantly, we will adjust our strategies to meet these new challenges. I'm asking all of you to do the same. The changes in rules and guidance can be difficult. I know the stress it creates. But we are responding to an unpredictable force that will go in directions that we cannot foretell.
Remain on guard and prepared to pivot as the virus changes its course. Today, Public Health has confirmed 14 new cases of COVID-19 in New Brunswick. In Zone 4, which is the Edmundston-Grand Falls region, there are 8 new cases. These are all contacts of previously confirmed cases. In Zone 1, which is the Moncton and southeastern New Brunswick area, there are 4 new cases, all directly related to travel. There is 1 new case in Zone 3, which is Fredericton and the St. John River Valley, related to travel. There is also 1 new case in Zone 2, which is St. John, Kings, and Charlotte counties. This case is related to travel. All of these new cases are currently self-isolating. We now have 126 active cases of COVID-19 in the province, and there are well over 1,000 people in self-isolation to help us limit the spread of the virus. 5 individuals are now in hospital, including 2 who require intensive care. Aujourd'hui, Santé publique.
Today, Public Health confirms that there are 14 new cases of COVID-19 in New Brunswick. In Zone 4, which is the Edmundston-Grand Falls region, there are 8 new cases. These are all contacts of previous confirmed cases. In Zone 1, which is Moncton and southeastern New Brunswick, there are 4 new cases, all directly related to travel. And there is 1 new case in Zone 3, which is Fredericton and St. John River Valley, related to travel. And there is also 1 new case in Zone 2, which is St. John, Kings, and Charlotte counties, and the case is under investigation, but linked to traveling. And all these cases are currently self-isolating. There are now 126 new cases of COVID-19 in the province. More than 1,000 people are in self-isolation to help us limit the spread. 5 people are in hospital, including 2 who require intensive care.
Number of confirmed cases of COVID-19 reported in New Brunswick. An individual previously identified as a case in Zone 1, the Moncton region, has been removed from the confirmed list of cases due to the identification of false positive results. Today, the focus of our concern is on Zone 4, which is the Edmundston, Grand Falls, and St. Quentin region. The area around the city of Edmundston transitioned to the red alert level last Thursday. Mass testing of asymptomatic people in that area was conducted. Public Health suspects that 82% of the cases in that area come from the COVID-19 variant first reported in the United Kingdom. Compte tenu du degré de transmissibilité.
Given the transmissibility of the strain, COVID Cabinet has confirmed Public Health's recommendation to expand the red alert level to the communities of St. Leonard, Grand Falls, New Denmark, and Four Falls as of midnight last night. All of Zone 4 is now at the red alert level, with the exception of St. Quentin and Kedgwick. I wish to express my thanks and gratitude to the people of the Edmundston area, as well as the leadership in these areas.
Strain. COVID Cabinet has confirmed Public Health's recommendation to expand the red alert level to the communities of St. Leonard, Grand Falls, New Denmark, and Four Falls as of midnight last night. All of Zone 4 is now at the red level, with the exception of St. Quentin and Kedgwick. If you do not need to travel for work, childcare, or a medical appointment, I encourage you to not travel in and out of the red zone of Zone 4. I want to express my thanks and my gratitude to the people of the Edmundston area, the leadership in that area, as well as the RHA staff and public health staff. It has been a great effort in this time. You have shown great fortitude in the face of ongoing challenges. I thank everyone who has followed public health guidance by limiting your contacts and reducing opportunities for the virus to spread. It is so important that people continue to get tested if you have symptoms, even if they are very mild. Please do not go to work. Please do not go to school if you have symptoms. Through your actions, we have a better chance of limiting the spread of this disease, and that is very encouraging. I want to thank our public health staff and all the others who have helped to manage this outbreak. We could not have done it without you. The circuit breaker for Zone 4 is working, but more time is needed to see its full effect. We will continue to assess its impact and determine when and how restrictions can be modified. We are also making adjustments to our vaccine campaign in light of new evidence-based information. Minister Shepherd is going to speak to some of the changes that we will be making. I do want to emphasize that we are committed to a vaccine program that is safe and effective. And while there have been adverse events reported in Europe associated with the AstraZeneca vaccine, these events are extremely rare. And there is a range. Some people are quoting 1 in a million, 25 per 20 million. It depends on which reports you're reading, but there is a range and it is rare. Of the 20 million doses given to date in Europe and the UK, there have been only 25 reports of this adverse event and none in Canada. The risk of developing serious illness and or death from COVID-19 is far higher. These vaccine-induced blood clots have not been reported in Canada. We have nevertheless made adjustments to our vaccination program to enhance safety and minimize risk. AstraZeneca vaccine will continue to be used, but only for those over the age of the age of 55 and older. For anyone who is 55 or older, if you are unsure about the safety of this vaccine, I can assure you it is safe, and I would have no problem recommending it or taking it myself. I am confident that this is a prudent and safe approach that will enable us to move forward with our vaccination program. And again, this is based on NACI recommendations. En dépit de ce changement,
So I'm confident that even with this change, that we will still have sufficient sources of vaccine to meet our goal of providing at least one vaccine dose to every New Brunswicker before Canada Day. We have come a long way in this pandemic journey, and the road is never straight.
We will still have sufficient sources of vaccine to meet our goal of providing at least one vaccine dose to every New Brunswicker before Canada Day, if everything goes well with respect to distribution. We have come a long way in this pandemic journey, and the road is never straight. There are twists and turns, blind hills, and potholes that can throw us off course. And we must be ready for them moving forward with determination to reach our goal. And we are getting there. And I wanted to throw in there that it does feel like those long, long drives when you were a child. And you kept asking, are we there yet? My parents packed my brother and I up when I was 7 years old to go to Florida. And it was a 3-day trip down and a 3-day trip back. And I can assure you, we did ask that question a lot as we played with Lego and Barbies in the back seat on the floor before seatbelts were the law. So I assure you, we are going to get there together. We have come so far together. So far, we are still the envy of other provinces and jurisdictions in Canada and outside. So let's hang in there, dig deep, and we are going to get there together. Thank you very much.
Good afternoon. Bonjour. Yesterday afternoon, Cabinet and the All-Party Cabinet Committee on COVID-19 accepted the recommendations of Public Health to extend the red level circuit breaker to include additional communities in Zone 4, the Edmundston region. St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls have now been moved to the red alert level, along with Edmundston and the Upper Madawaska area. The St. Quentin and Kedgwick regions in Zone 4 remain yellow. We also announced yesterday that based on the recommendations of the National Advisory Committee on Immunization, we will no longer be administering AstraZeneca vaccine to people under the age of 55. As Dr. Russell explained, the risk from the vaccine is very low, and we are taking these extra actions out of an abundance of caution based on the advice from Health Canada. This is meant to shift in our use of the AstraZeneca vaccine. Beginning today, planned clinics for first responders will proceed using the Pfizer-BioNTech vaccine. Planned clinics for high school teachers will be rescheduled very soon. An AstraZeneca vaccination clinic organized by Horizon Health Network for individuals 55 and over will occur on April the 1st in Zone 2, the St. John region. Anyone in this age category interested in receiving a vaccine may register for an appointment by visiting gnb.ca/book-a-vaccine or by calling 1-833-437-1424. Please only call that phone number to book an appointment at a regional health authority clinic. It is not an information line. St. John was chosen for this clinic as that is where the current vaccine supply is located. More AstraZeneca clinics in other zones will be scheduled for people 55 and older in the next week, as we expect to receive 30,000 more doses. Please do not contact a pharmacy to book an appointment at one of these clinics. At this time, they are only being offered by the regional health authorities. We remain on track to reach our goal of providing all New Brunswickers who wish to be vaccinated with their first dose by the end of June. To date, 12% of the population aged 16 and older has received at least one dose. People aged 75 and older, rotational workers, regular cross-border commuters, and truck drivers who regularly cross the border can make an appointment to receive their vaccine by contacting a pharmacy. Individuals with complex medical conditions may book an appointment through Horizon and Vitalite clinics. People who are 40 and older with 3 or more chronic conditions may also schedule an appointment now through the regional health authority clinics, which will be booked beginning in April. More information about eligibility and how to register for clinics is available by visiting gnb.ca/coronavirus and clicking on vaccines. Throughout the pandemic, we have constantly adjusted our approach as we learn new information. We will continue to respond nimbly and will make decisions based on the recommendations of health experts to best protect all of New Brunswickers. Easter is coming up this weekend, and I know how many people have plans to celebrate. I urge you to continue to follow the rules that apply to your community. If you are in the red alert level phase, please stay within your single household bubble, which can be extended if needed to include a caretaker, a family member who requires support, or one other person who needs support. As a reminder, faith venues in the red level may only offer virtual or drive-in services. People living in red level regions must wear a mask in indoor public spaces and in outdoor public spaces when physical distancing cannot be maintained. Those in the yellow level must spend time only with their steady 15 circle of contacts. Faith venues can remain open in yellow regions as long as 2 meters of distance is maintained between people who are not from the same household or steady 15 group. Venues must operate at a maximum of 50% occupancy levels, and everyone must wear a mask. People in yellow level communities must wear a mask in indoor public spaces, and everyone should wash their hands frequently. Please avoid all unnecessary travel in or out of Zone 4, red level area. This is an especially difficult time for people living in the impacted red level area in Zone 4, and my thoughts are with everyone in these communities. I am confident that if everyone in the region continues to follow the rules that are in place, these measures will be short-lived. With your patience and cooperation, the entire province will be able to return to yellow level very soon. Even with the presence of the variants, we have shown in the past that we are capable of getting outbreaks under control. We did it in Zone 7, the Miramichi region, earlier this month, when we experienced an outbreak there. I know we can do it now in Zone 4. We are all tired of the restrictions that COVID-19 has placed in our lives, but the finish line is in sight. By continuing to follow the rules that apply to our communities and by getting tested if we are experiencing any symptoms, we will make it to the end of the pandemic and come out of this the other side together. Thank you. Merci.
Thank you, Minister Shepherd and Dr. Russell. Merci beaucoup, Minister Shepherd et Dr. Russell. We will now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros? Merci beaucoup. Laura Brown, CTV.
Hi there. I'm wondering if you've received any complaints from anybody who has received the AstraZeneca vaccine so far, so teachers, first responders. Has anybody complained, and are you advising anybody to watch for any symptoms?
So my understanding is we do have a weekly report here in New Brunswick, and none of the adverse events that have been reported, number one, are including anything related to blood clots. And so secondly, yesterday when we did the press release around the change in recommendations from NACI, we did actually indicate that if people had, and we do have a Q&A, I believe, on our GNB website around seeking medical attention if you have symptoms. So primarily it would be towards people who are under the age of 55 who received the AstraZeneca vaccine within the last 20 days, because we know that the onset of symptoms in this very, very, very rare blood clotting phenomena is only occurs between 5 and 20 days after vaccination.
Quick follow-up, Ms. Brown.
Yeah, I'm wondering for the people that can now book, the 55 older group that can now book, are they being, they can phone the number, but will they be booked within the month of April, or what's the timeline that you guys are looking at for that?
I can answer that, Laura. Absolutely. I mean, the clinic scheduled for April the 1st is, they're going to be receiving those doses that day. So, and the other 30,000 that are coming this month, so we will be booking those for, ASAP. In all honesty, as soon as we have a confirmation that the doses have been shipped, we ensure that the clinics are then confirmed.
Thank you, Ms. Brown. Vicki Hook, our CHCO.
Thank you, Bruce. My question is for Dr. Russell or Minister Shepherd. With changes to the AstraZeneca vaccine rollout in mind, and with some individuals under 55 already having had their first dose of AstraZeneca, does a person's second dose of vaccine have to come from the same manufacturer as the first dose? Could a person who's had AstraZeneca have Pfizer or Moderna as the second dose?
Hi, Vicki. So basically, we're having those conversations with NACI, and as of right now, because you can wait 16 weeks in between the first and the second dose, we'll have more information on that, but it wouldn't be likely that if you're under 55, you're going to get another AstraZeneca dose at this point. But again, it's an evolving situation, and we'll keep everyone posted.
Do you have a quick follow-up, Ms. Hogarth?
I am just wondering when the vaccine will be offered to all supply teachers.
So I'm sorry, I'm just going to clarify that. Do you mean throughout the educational system?
Yes.
That's still being determined as we are rolling this out and pivoting to possibly make bigger changes. Then that news will be coming, on our briefing days in the next short while. Oh, and Dr. Russell could say.
Oh, I just wanted to add on the topic of EECD. I just want to give a shout out to EECD folks in Zone 4. They've been working incredibly hard managing all the situations up there. So I just wanted to thank them for all their hard work.
Thank you. Harry Forstall, CBC.
Thank you, Bruce. My first question, how much of a threat is the Brazilian variant compared to the UK variant?
Hi, Harry. It's very, very concerning what we're hearing and seeing about the Brazilian variant thus far. Certainly in other jurisdictions such as Brazil, it did pretty much take over the entire country in terms of the dominant strain. It is now been detected in Ontario. It has now been detected in British Columbia. And I know that in recent days there were upwards of 215 cases announced of the Brazilian variant. So we are very, very concerned. We've been dealing with the UK variant thus far, and that's a challenge in and of itself. My understanding is the Brazilian variant is more transmissible and has higher mortality and morbidity, but I can't quantify that.
Mr. Forstall, do you have a follow-up?
Yes, thank you, Bruce. Ontario public health officials are now saying that the outbreak, the pandemic in Ontario is, in their words, completely out of control. How worried are you with that situation in Ontario, given where we are now?
Well, Harry, throughout the pandemic, we have seen several waves. Obviously, we're seeing a third wave in Europe right now with more lockdowns. We've been so fortunate here in New Brunswick that our approach, our collaboration, our public health measures, and the cooperation and compliance of the public has been very well has served us very well in terms of where we are at now. Do we have a challenge between now and the middle of June when we want to get one dose of the vaccine into the majority of the population? Yes, I see some challenges ahead, but I think what gives me confidence in the next 2.5 months in terms of the work that's ahead of us is how hard we've worked so far and how that success we will continue to build on. But we do have challenges ahead of us if those variants start to become play a bigger role in the outbreaks that we have seen and moving forward.
Thank you for that.
Minister Shepherd's going to provide some comments.
I just want to, because I think it's so important, not only with what Dr. Russell has just conveyed, but, it's not been easy keeping our borders tight. And we know how inconvenient and how stressful it has been for some families to live with these tight border controls. But it has proven to be our success. And it has proven to given us the opportunity to manage COVID-19 and the variants that have come before us. So, when we get to mass vaccination, we will be able to take a breath But for now, I find that this is going to be the most difficult 10 to 12 weeks for people as we get to the other side of this, because everyone's tired. Everyone wants to be able to go see their loved ones in other provinces or vice versa. And we just have to maintain what we're doing in order to keep this at bay.
Thank you. Isabelle Arsenault, Radio-Canada.
Hello. Thank you, Bruce. My question is for Dr. Russell or the Minister. There's a municipality in Zone 4 and residents who really aren't happy. And what would you like to say on public health's part? Will we be informing local authorities about these? Why have you waited so late before releasing the news last night? Yes, I heard that there were people who were not happy with the fact that we issued our news very, very late concerning the change. But really, we had many things to manage yesterday. There were situations in Zone 4. We had two cabinet committee meetings about with the COVID cabinet and the regular cabinet, and as well, we spent the entire weekend meeting with NACSI and also with all the other chief medical officers to have discussions concerning the new effects of AstraZeneca. Yesterday was a very tough day, and we had to make decisions and have discussions and communicate all that information. It took a while. I agree. We would have wanted to do it more quickly, but it took a while, and we did our best. And also we had calls with the leaders in Zone 4 because we wanted to inform the leadership before issuing all the information publicly. All right, do you have a follow-up question? Yes, I would like to know also when it comes to schools, there are some parents who say that the isolation or lockdown and requirements vary from one school to another. So, okay, you mean when? Are you talking about when the schools are closed for contact tracing? The information doesn't seem to be consistent from one school to another, and not even to the parents. Well, I have to say that each school is different when it comes to risks. So it depends for each school what the medical health officers decide, and the communication of risks and which people should stay home, often for different reasons. Maybe there was exposure, or maybe there were operational plans that indicated that there wouldn't be enough staff to keep a school open. So I understand that's not consistent, but can't be exactly consistent because the risks aren't the same. Thank you. Cal Smith.
Thanks, Bruce. First, I'm wondering if we could hear more about the situation in Edmundston. I heard Dr. Russell say that the measures were working. I guess, can we just hear a bit more about that situation and how concerned you are there?
Well, I think in terms of compliance, we're definitely seeing a lot of great compliance with respect to public health measures. So that's number one, and that's probably one of the most important things, really. Being able to get ahead and stay ahead of contact tracing is very important, and obviously the more cases and public exposures that have to be announced and dealt with, that's more challenging. And the testing, we've been able to boost our capacity. We've done the mass testing. We continue to do lots of PCR testing in that area. So in terms of what's going well, those are all the pieces that are going well. We are watching the hospital capacity very, very closely with respect to availability of beds, but also the availability of staff. So in every zone, the RHAs report on how many staff are affected in each zone, which does affect capacity. So from a public health perspective, in terms of the number of cases, we're not seeing the number of cases go down as quickly as we'd like. So that's still one area that we're concerned about. And obviously having 1,000 people in self-isolation right now who at any moment could become COVID positive, that is a large number. So we're watching that very closely.
Mr. Smith, do you have a quick follow-up?
Yes, thank you. I don't know if this is for Dr. Russell or Minister Shepherd, but I'm wondering about the that situation in Edmundston and how that connects to the Atlantic bubble. I guess what are the thoughts? I know we're still 20 or so days away, but what that could mean there.
Thanks for that. At this time, we don't think that the Atlantic bubble is at risk, but as Dr. Russell said, when you have 1,000 people, over 1,000 people isolating, we don't know what's going to come out of that. This is the variant, which is highly transmissible, so we're just monitoring it on a day-to-day basis. The premiers are staying in touch, and you know, our goal is to get there, and so that's why we need our public to support us. And our leaders, our municipal leaders, our provincial leaders, to support the message of, you know, isolating, washing hands, wearing masks, following direction, and let's get to the other side of this as quickly as possible. People stop moving, the variant stops moving, COVID stops moving.
Thank you. Alexandre Boudreau, l'Acadie Nouvelle.
Justin Dupuis, l'Acadie Nouvelle. Thank you, Bruce. I would like to know, Dr. Russell, given the situation that we see in Edmundston, they'll be staying red for a while. We would like to know why we aren't redirecting more staff and perhaps more doses towards Zone 4. Well, that's what's happening right now. So if the cases continue to rise in that zone, I mean, that's not the direction we want to take. So yes, doses will be sent to vaccinate the truckers, those who have to cross the border, and the healthcare workers, etc. Mr. Dupuis, do you have a follow-up? Yes, but I'd like to know if we intend to increase it, not just for those who cross the border, etc., but might we try to add more vaccines for the people in general? Well, I think we've increased the vaccination rate at this time in that zone. That's what I've understood. All right, thank you.
It's my understanding that I believe in our plan, we have an additional 3,100 vaccines that are going to Zone 4 over the next several days, over the next week.
Merci, Monsieur Dupuis.
Okay.
News.
Hi there. Thank you, Bruce. I wonder if there have been any instances of people canceling their vaccine appointments in the last day or so, as we've all learned about the news from Massey regarding AstraZeneca.
I haven't heard that, Tom. We are the ones who canceled the clinic for Monday, but all the rest of them are remaining, and we're switching out the AstraZeneca for mRNA vaccines. That's what I've heard. So that's what's happening.
Mr. Bateman, do you have a follow-up?
I do. I wonder about, as the rollout changes here, and high school teachers are affected by not getting the AstraZeneca vaccine now, does that jeopardize the opening date for high schools back to the full attendance
My understanding is
that we
they're
were
going to
talking
get. My understanding is they're going to get one of the mRNA vaccines, Tom. And we did have quite a few discussions with EECD around all this because again, we knew they had a date. We had a date in mind that we wanted everybody to be able to go back to school full time. And my understanding is they were able to pivot and shift and make that happen.
Clinics are being rescheduled as we speak.
when will the high school teachers have to be vaccinated by to keep the April 19th date or April 12th date intact?
Since we want it 14 days post, it would be nice if it were happening today. So it's going to be any day. And we may have some schools that are, that will still stick with their schedule. But keep in mind that I believe one of the areas, no, Bathurst isn't in zone 4, is it? No. So it will probably delay them a day or two.
Thank you, Mr. Baker.
Okay, thank you both.
Bobby Jean McKinnon, CBC.
And hello, Dr. Russell, how will you handle the second shot vaccine for people who've already had one shot of the AstraZeneca? Can they get a shot of another vaccine, or will it have to be AstraZeneca? And should these people expect to get it, or do they skip it?
So for the AstraZeneca, if you're obviously 55 or older and you've had it, then you will get the second dose of AstraZeneca. For those people under 55 who have received that first dose, we are going to be taking our direction from NACI. Obviously, we have 16 weeks in between the doses, so we will have more information as NACI provides that to us. I can't foresee that the people under the age of 55 would get a second dose of the AstraZeneca, so at this point, I'm assuming that they'll get an mRNA vaccine.
Ms. McKinnon, do you have a follow-up?
Yes, I do. I guess this would be for Dr. Russell as well. What proportion of our vaccine comprises of AstraZeneca versus the other vaccines? And should people over 55 now expect that they'll get the AstraZeneca vaccine?
Well, in terms of the exact numbers, I'm not sure what's on the dashboard in terms of what's out there, but AstraZeneca was not a very large portion of our rollout in terms of all the planning that we've done and knowing how many mRNA vaccine doses we were going to receive. So AstraZeneca has only ever been, we've never planned for it to be a large part of the rollout. The fact that we're getting 30,000 doses from the U.S. Shortly, that was a new development, so we'll be using those when they arrive. But in terms of the exact numbers of the doses, I know up until now we've received 7,000 doses of AstraZeneca. Of those, 75% of the 7,355 people in New Brunswick were vaccinated with AstraZeneca, and 75% of those who have already been vaccinated with AstraZeneca are under the age of 55. So we've had a total of 7,355 people in New Brunswick who are already vaccinated with AstraZeneca. But that's a small portion, and again, I don't have the exact number of Moderna, but when you think about it, I think we passed the 11% mark of the entire population of New Brunswick having been vaccinated thus far with either Moderna, Pfizer, or AstraZeneca, but the majority of the population who has been vaccinated up until this point, it has been with Moderna or Pfizer.
Thank you. Eloise Rodriguez, Radio-Canada.
Oui, Dr. Russell.
Yes, Dr. Russell, I'd just like to hear in French concerning the vaccine when it comes to the return to full-time schooling. All the clinics for teachers that had been scheduled for this week have been replaced. We have added the mRNA vaccine, and if they weren't able to be scheduled this week, then there may be a few extra days for one or two schools. A 1 or 2 day delay from April the 12th because we have to wait 14 days after the vaccine before those teachers return to school full time. Do you have a follow-up? Yes. just to come back to communication in the region of Edmonton, I know that you had lots of meetings yesterday, but given what was happening, we could have thought about the red zone perhaps continuing. Could you have been more proactive in your communications?
I'm going to answer that, and Dr. Russell can certainly add to it if she likes. Following the number of cases, I think that we reacted appropriately with our timeline. As Dr. Russell also explained, we are unique in New Brunswick, whereby we have a COVID cabinet committee, an all-party COVID cabinet committee, and then cabinet. And so we have been extremely responsive in having those meetings as quickly and nimbly as possible to support public health in getting their message out. And so public health worked onerously all of the weekend, Saturday night, Sunday, into Sunday evening, and then Monday reported to COVID cabinet, and then we put out the press releases. So I'm satisfied that we have moved as quickly as possible, and the communities have been supportive of of the decisions we've made, and they're following public health advice.
Al Hakim, Global TV. Aya. Andrew Waugh, Brunswick News.
Thanks, Bruce. Minister Shepherd or Dr. Russell, can someone walk me through exactly, besides the general population, who's gotten the AstraZeneca? And I'm talking about first responders, school teachers, that kind of stuff. Can you just give me a picture of what those specialized groups, which ones have received AstraZeneca, please?
So let me see if I can help somewhat. We were scheduled and we've received, I think, a maximum of 10,500 doses of AstraZeneca. I think that works out to, out of 123,000 that of all the vaccines we've received, that works out to about 8% or a little under. About 75% of those doses have been administered to first responders and educators. So I can't pinpoint you exact numbers on what first responders have received, but if my math is right in my head, I'm going to say that I think there were 4,500 staff in high schools total that were to receive AstraZeneca. And we have 3 high schools left out of that to do. So that will be changed out. So I guess you can work with those numbers, Andrew, maybe.
Yeah, I can give it a shot.
Do you have a follow-up, Andrew?
I do. Minister, have you heard from any of these groups since all this news broke? Like, have you heard from, the Rhett Cummings of the world and, the Cupies of the world? Are they worried or are they radio silent right now?
I have not received any messages from any organized group. I think as of this morning, I've had 2 emails, but not specific to blood clotting or anything like that. Just asking if they had adverse events or adverse effects, who should they contact? That's the extent of what I've received right now.
Okay, thanks.
Thank you, Mr. Waugh. Bernard Labelle, Radio Canada.
Hello, my question is for Dr. Russell. Given the uptake of cases over the past 2 weeks, there are many people in the medical field as well that there should be vaccination clinics to the general people to try to stop the spread of COVID in the area. I think you answered that in part before, but I'd like to have more details about this. I believe the Minister Shepherd already answered concerning the fact that we are sending more doses to that area to vaccinate not just truckers and rotational workers and those that have to cross the border for work. But when it comes to clinics in April, there will be 3,100 doses will be sent to that zone. Do you have a follow-up, Mr. Lebel? Yes, do we have details on the number of doses that will be sent to the population in general, or are we still following the established schedule?
Yeah, so it's 3,100 more over and above what was proposed, and I don't have those numbers in front of me. They will be 3,100 additional doses. Those doses will also be set up through the RHA clinics.
Merci, Monsieur Lebel. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. When you announced the circuit breaker on March 25th, it was for at least 4 days. The area has since expanded. So how much longer do you think it will need to continue, and what has to happen to get back to a more restrictive or a less restrictive state?
Well, it's hard to predict at this time. I mean, we used to set timelines for how long things were going to need to get under control. But at this time, we're just going to monitor the situation on a day-to-day basis. And again, we watch the trends every day, and we will continue to do that. So I can't really put a timeline on it at this time, but certainly having the case numbers drop, having the number of people in self-isolation go down, and also making sure that the contact tracing, the testing, all those things are continuing to be successful within a certain time period, and also watching the hospital capacity.
Do you have a follow-up, Ms. Fraser?
I'm also wondering, what's the latest on the ship in St. John with members who have tested positive?
I'm going to just answer to that we are working with the Port of St. John. I don't have any more updated numbers specific to that.
Okay.
Okay, I would just like to mention, Andrew, when I was talking about the numbers, and I said three more. It affects 3 high schools. I made an error. It is 3 communities affecting 10 schools. I just wanted to clarify that for you.
Thank you. Erica Butler, CHMA.
Oh, thanks, Bruce. So my question, surprise, surprise, is about the border with Nova Scotia. Today, Nova Scotia announced 3 new cases. They have a total of 24 active cases. When was the last time that public health reassessed the situation with that Nova Scotia border? And what is the argument behind continuing those border restrictions, for Nova Scotians coming into New Brunswick at that border?
I'm going to start with this, and Dr. Russell can certainly add to it. As I've explained earlier, New Brunswick has done so well because of our border restrictions, and it's not been an easy time for families, loved ones, to have to stand by these restrictions. And with regards to Nova Scotia, look, they are going to be. I know that their cases are down. I'm going to proudly say that, Nova Scotia has us at their front and the Atlantic Ocean at their back. And so we carry a lot of responsibility in protecting them. So I don't see our restrictions coming down any faster than the dates that we have proposed, and it will be monitored very regularly.
Hold on, Erica. Erica, can we let Dr. Russell add? Then we'll get to your follow-up.
Yeah, so the epidemiology teams from all 4 Atlantic provinces are meeting every week, and they are continuing to assess the situations in all 4 provinces. And, you know, they take into account what is happening in other jurisdictions, and they are very aware of the risks of the variants in other jurisdictions, and the fact that if we're not careful, you know, in terms of what Minister Shepherd was saying about, you know, when people move, COVID moves, the variant moves, variants, then we just want to be as cautious as we possibly can be, knowing that with the variants, the transmissibility means that an outbreak then could be, you know, in all 4 provinces at the same time if we're not careful. So again, we're just trying to be as cautious as we possibly can be at this time, knowing that the variants are really going to be the biggest challenge as we try to roll out our vaccination programs. We are the area of the country that has the highest population of people over the age of 65 per capita. So we do have a more vulnerable population. So when you look at the fact that we vaccinated our long-term care facility residents and healthcare workers for the most part, that's one particular area in terms of vulnerable populations that we've been able to protect. But again, with the variants, the morbidity and mortality for people in younger populations, for instance, in BC right now, they're having a lot of hospitalizations and bad outcomes for people between the ages of 29 and 49 with the variants. So again, we're keeping our eye on all of that that's taking place, and we're trying to navigate it as best we can.
Thank you. Ms. Butler, do you have a follow-up?
Yeah, I noticed that a decision had been made to lift isolation requirements for rotational workers who have had a first dose of the vaccine 14 days prior. Will public health be considering lifting isolation requirements associated with travel from Nova Scotia in general for people who have had a first dose of the vaccine 14 days prior?
So I think that's still up for questions, and with regards to the rotational workers not having to isolate, they will still have to do a 5-day and a 10-day testing. Because while they will be protected with the vaccine, it is a personal protection. It does not mean they cannot get COVID-19, and it does not mean they cannot transmit COVID-19. So until we receive mass vaccinations and the greater portion of our population is protected, public health measures need to be followed. So I don't see that changing today. I'm sure it will be evaluated going forward.
Thank you, Ms. Butler. Thank you, Minister. Thank you, Dr. John Woodside, Alt New Brunswick. Jennifer Bishop, Brunswick News.
Hi. My question is for Minister Shepherd, I believe. I have another question regarding the scheduled vaccination clinic that was postponed in Bathurst and Campbellton areas. I guess how many doses were needed for the high school staff at the postponed clinics, and where are those doses coming from now that a different type of vaccine is going to need to be used?
I think we are going to have to get back to you with those numbers. I don't have those numbers in front of me.
Okay, and do you know, I guess, which vaccine is being used and where that vaccine is coming from? Like, was it allotted for somewhere else and is now being diverted to the high school staff so that the plan to reopen high schools can go through?
My understanding is that it will be the Pfizer-BioNTech vaccine, but I don't know that we're going to be seriously interrupting anyone else at this time for those for the number of doses it requires.
Okay. And I guess for my follow-up question, do you know when these clinics are going to be held specifically? I know you said they're in the works now, but is there any type of timeline at this point?
I don't have that right now. It's going to be as soon as possible. We understand we have an agenda and we don't want to delay the school openings. And so, our department is working with the ECD to arrange that as quickly as possible.
Thank you, Ms. Bishop. Thank you, Dr. Russell. Thank you, Ms. Shep. You can.
Just coming back to the restrictions and public health measures after people have been vaccinated, our goal is to get everybody in the province who wants a vaccine vaccinated by mid-June. Now, everybody who does get that first dose, whether it's AstraZeneca or an mRNA vaccine, that's one dose, and we do know that it offers quite a good amount of protection from the risk of getting hospitalized and from the risk of death. But that doesn't mean that we want people to change anything that they're doing until that time that we have the majority of the population vaccinated with at least one dose. And it could be more than that in terms of the protective factors that that will provide for the population. So I did have a question. Even my mom was asking me this morning, does that mean that I've got my vaccine now? Can I hang out with other people who've been vaccinated? Nothing changes. Everything that we are recommending right now in terms of masking, hand washing, physical distancing, et cetera, the number of people in your bubbles and small numbers of close contacts, that remains the advice until we decide that the risks are low enough that we can change those measures.
Elizabeth Fraser, if you're still on, Mr. Shepherd has a quick update on a question for you.
Thank you, Bruce. I just want to let you know that it's our understanding it is 6 crew members from the anchored vessel in the outer harbor at the Port of St. John that tested positive for COVID-19. And public health officials have been working with the Port of St. John and Public Health Canada to monitor the situation. I believe the cargo of that ship is being offloaded in the next few days. And one crew member had been isolating on shore. Other than that, that's the extent of the information I have today.
Voilà la fin de notre mise à jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.